Hello, everyone. It's been a while. And as promised a while ago, I was going to be bringing back Mental Health Moment. Well, here's the first one. I've been asked by many people the difference between a mental health clinician and a clinical social worker. Like, what's the difference, right? And people always want to know which one is better. Well, to be honest, both work well. It's more of your preference in figuring out what works for you. Yes, I personally am a clinical social worker, but let me break down some differences between the two so as you're looking to find a therapist and what works for you, you'll have a little bit of knowledge about the difference. So when thinking of a mental health clinician, right, and the specialization and training, they typically hold a degree in psychology, psychiatry, counseling, or marriage and family therapy. They can have like PhD, they could be a psych doctor, things like that. But when you think about their focus, they specialize in diagnosing and treating mental health disorders through various forms of therapy, such as cognitive behavioral health therapy, psychodynamic therapy, and other evidence-based practices. When it comes to their training, they have training in mental health assessments, clinical diagnosis, and therapeutic techniques. As far as their role in therapy, and thinking of the assessment and diagnosis, often conduct detailed assessments and are skilled in diagnosing a wide range of mental health conditions. Therapeutic interventions, when you think about that part, they use specialized therapeutic techniques tailored to individual needs, focused on symptom reduction and improving mental health. Their main focus in treatment is normally centered around mental health and emotional issues, often working in private practice hospitals and mental health clinicians. Now, when you think of a clinical social worker like myself and the specialized training and things like that, education normally holds degrees in social work, MSW, DSW, etc., and are licensed. When you think of the focus, we're trained to address broader social issues that impact mental health, such as poverty, unemployment, and family dynamics. Training, when you think about the training, we emphasize on a holistic approach, considering the client's environment and social context. Our role, a clinical social worker's role in therapy, when you think of the holistic approach, focuses on the person and environment perspective, considering how social, economic, and environmental factors affect mental health. When it comes to case management, often involves coordinating care and connecting clients to community resources, support systems, and services. Thinking about focus of treatment addresses both mental health and social issues, helping clients navigate complex systems and access resources. When you think of overlapping areas between the two, both mental health clinicians and social workers can provide therapy, and their roles may overlap, especially when it comes to offering support, counseling, and therapeutic interventions. Both professions require licensure and adhere to ethical standards, ensuring that clients receive competent and professional care. Some of the key differences will be scope of practice, right? Mental health clinicians typically have a narrower focus on mental health, diagnosis, and treatment, while social workers take a broader approach, addressing social determinants of health alongside mental health issues. Training and expertise between the two, mental health clinicians often are like specialized in therapeutic techniques, whereas social workers are trained to provide comprehensive support that includes case management and advocacy. Now, as you see, both can overlap. There are clinical social workers. We do diagnosing, we do assessments just like the mental health clinician. And you may find a mental health clinician that will advocate and do some of the things like a clinical social worker. But it's just really finding the one that works for you. So understanding these differences can help you as an individual choose the right type of professional for your specific needs. Now, I always talk about it's okay to shop around and look for a therapist that's the right fit for you. But I just don't want you to get caught up in, oh, they have to be a mental health clinician, or oh, they have to be a clinical social worker. But the purpose of this video was just to get you to understand the differences between the approach so that you're not going in expecting a therapist, whether they're a mental health clinician or a clinical social worker, to provide services in a particular way. I hope this video has helped you in making a decision. If you feel that you would like more information or you have questions, feel free to inbox me. Go ahead, comment below. I will answer any additional questions. Have a nice day.